Hi, everyone. Welcome back to Ask the Dentist, Chapter 3 of What's This All About? Hydroxyapatite. And this week, we're going to talk about safety and concerns. Is it safe? This is probably what most of you have been waiting for. This is where all the controversy and talk and behind the scenes stuff goes on. A lot of people are emailing us. Hi, Dr. Staci.
Hello.
It's just driving us really. It's a frenzy. People, first of all, we're on the internet, and people like to whistleblow. They like to find that, and here we have this great alternative to fluoride, and we're already it's already controversial, which is very sad. But we're going to try and debunk that today. We'll talk a little bit about the backstory, history. It's been around for 50 years. We're going to talk about the body, the scientific body in the EU that has approved certain versions after a lot of, I think it was 8 years of study, their final decision, and then who can use Nano. And so we'll kind of talk about all of this. And how long have you been using a Nano-based toothpaste? Let's start with that.
I mean, 2018 or 9. I mean, as soon
Yeah,
as Boca launched and I caught
exactly.
wind of it, I
Yep.
was thrilled because the research is there and it's biomimetic. And I'm an integrated biological functional dentist, and I'm all about biomimetic materials.
Right.
But like you, when the internet rumor mill started spinning its wheels, which was fairly recently, and I will say, it's a small group of people that seem concerned, but they're quite loud, and it's good to have these conversations. I mean, I took pause, and I know you did too,
Mhm.
um, because we want to make sure we're making appropriate recommendations, and this is why we
Mhm.
love science. Um, but this is when the SCCS stepped in, and so, as you mentioned, hydroxyapatite has been around since the 70s. So it's
Yep.
50 years of use and research, with more and more research coming out, it seems every month.
Right.
It's just exploding. It's particularly exploding in Europe, and it's been around in Japan forever, and Italy, and it's fairly new to the US. And so while I respect the conversation and always bringing safety front and center for anything, I also think we need to really look at the science. And
And
so that's what we're going to talk about.
yeah, and it's been in use in toothpaste, not only toothpaste, but mouthwash in the
Mhm.
medical industry, coatings on implants, not just dental implants. It's used to target tumors, or at least to bring
Bone
medication to certain
grafts.
areas, bone grafts. I mean, this is not something that just appeared recently and that we don't have a long basis of clinical safety and history for. So that is, I think that's encouraging. Again, 50 years is a long track record,
Mhm.
but we're going to talk about all we're going to try and touch on all the points that there are a few, not a lot. I take that back. There are a few websites, and by the way, these websites have products that do not contain any form of hydroxyapatite or just the micro version. It depends on which website. And so for them to reformulate, you have to think that for them to reformulate is going to take them time. Maybe they've been bashing Nano for a long time and it's hard to reverse that. I'm thinking of one website in particular. It's kind of hard to go back on something, especially when that website said that the Nano version had been banned in Europe, which we know was a lie.
Yes,
Somehow,
may I interrupt? I
yeah.
still get this constantly in my
Hmm.
comments
Yep.
that it's been banned in Europe. It has not been banned in Europe. I would really love if everyone could stop repeating that rumor.
Right.
It's the opposite. It's been approved in Europe
Right.
from the SCCS.
Yeah.
And so let's get into that,
So,
okay?
but during the time that this website was saying that it had been banned, and this is only about a year ago, maybe a year
Yeah,
and a half ago,
sure.
and again, this website does produce products that do not have any nano hydroxy in it, apatite in it. In fact, there's not much talk about remineralization. It's just about the safety of their products, and that's fine. That's great. It's important to realize that during that period of time, when they said it had been banned, it was never banned. It was under investigation
Exactly.
by a committee, the SCCS. Do you want to talk about the SCCS now?
Yeah, in
Okay.
fact, yes, I will, because have really been paying attention to this. And what's so interesting with the fact that they stated it was banned, even the preliminary opinion from the SCCS
Mhm.
said they approved it. That was their preliminary opinion, not set in stone. So, what is the SCCS? Let's get into that. So I want everyone to think of the SCCS, which stands for the Scientific Committee on Consumer Safety. It's sort of like the FDA here. And it's been researching nanohydroxyapatite and its safety in toothpaste and oral healthcare products for several reasons. And basically, they oversee cosmetics and consumer goods. So it's not food,
It's not
it's not
foods.
supplements or nutritional supplements things. It's cosmetics, which toothpaste is considered a cosmetic. And so this is a good thing. We want the ingredients in our cosmetics to be scrutinized, and we want them to be approved or not approved based on safety. And we wish, of course, the FDA did more of this. So, but the SCCS has a very strong track record. Now, why did they start digging into nanohydroxyapatite? This was back in 2015. So it's because there was an uptick in its use. So nanohydroxyapatite was gaining popularity as an ingredient in toothpaste and oral healthcare products because of these amazing benefits that it had with tooth remineralization and sensitivity, cavity prevention, whitening, et cetera, et cetera. And so they really wanted to determine were nanoparticles, nano properties appropriate for use in consumer goods. So this is great, right? The consumers were asking, people were talking about it. They wanted to make sure that nano-sized particles didn't have any interactions in the human body that could potentially pose safety risks. And so they started digging into the research. They wanted to make sure that oral exposure, oral absorption wasn't going to create systemic health issues like what we're concerned of with fluoride, which is considered a neurotoxin. And again, we're going to get into this, but it's really apples and oranges. You know, this is a biomimetic material that we do have hydroxyapatite in our body. Nano is synthetically created, but how it's manufactured matters. And that's what we're going to get into. And so they wanted to create regulatory guidance on nano hydroxyapatite particles. That's great. Amazing. So this all started in 2015. And I think it's important to understand what is the SCCS, who makes up the SCCS. So again, the Scientific Committee on Consumer Safety is this body in Europe, and it utilizes an independent panel of experts to advise the EC, which is the European Commission on Health and Safety Risks of ingredients found in non-food consumer products. The experts that make up the SCCS, they're usually from the toxicology field. That's wonderful. But specifically with this hydroxyapatite opinion, 10 had toxicology backgrounds, and then one additional person was from pathology, biochemistry, chemistry, and physics. So this is a well-rounded group of experts who are really digging into the research. And so what do? They look at the old research, the scientific data, the literature, and they will also conduct their own research
Exactly.
and determination. So you know, this is why they didn't make their final opinion until March 2023, after their initial opinion in 2015 said, yeah, we're pretty confident nanohydroxyapatite in toothpaste is good, but we want to make sure. So they took 8 years assessing if there was cytotoxicity, pineal gland calcifications, all these things that I hear spinning around the internet. And they came up with their conclusion. And so, let's
I
see.
yeah, I
Should
would
I
argue I
final
would argue
opinion?
that this is uh, a more responsible group than the FDA. As we all know, the FDA has a lot of influence, outside influence. There's a lot of corporate
Mhm.
influence. And this group of 10 scientists, and they rotate in, they rotate out.
Yes.
They are chosen by a committee. It's quite an honor to be on it. It's unclear if they're getting paid or not, but it's probably nothing special. And what I like about them is that they do their own studies. They do a systematic review of all the studies out there. They take their time. There's no pressure on them. And when they vote, I think this is wonderful. When they vote, the vote is recorded, but not who voted yay or nay against it,
Mhm.
because
Yeah.
this corporate pressure. I mean, it's everywhere in any capitalistic society, including in the EU. That is something you really have to be concerned about. And so I'm very confident that this is a very reputable group. They've been right. If you look at the history of all their decisions, they've been very consistent and very accurate. And back to what you were talking about, Nano, they were considering all nano products. It wasn't just nano hydroxyapatite that
Yes,
got them
that is true.
excited.
That is true.
It was all these other and
Nano
this is again not
silver.
food, it's
Yes.
cosmetics, but
Yes.
also toothpaste falls into that category,
Mhm.
even though it can be ingested. But stuff does get through the skin and can get ingested through the skin. So this was something that had to be dealt with. There are nanoparticles that are horrible, and especially if they don't dissolve, like nanotitanium in a what's that called when you try and hide a blemish? There's a base layer, a base cosmetic
Foundation, like foundation.
foundation,
Yeah.
right?
Sealer.
And also sunblocks, and that does get absorbed, and that small,
Yes.
tiny particle of titanium does get into the body, and it probably never comes out again, and that is a big concern. So
Yes,
they
or
were
expensive.
considering all these in this narrow kind of segment, cosmetics. They were considering, and they have banned a lot. A lot has been banned, and
Yeah.
again, they have banned things that the U.S. has not banned.
Yes.
Again, we're
They did
talking.
not ban
Yeah.
nano hydroxyapatite. However, there are different types of nanohydroxyapatite, and that
Yes.
again is something you and I find frustrating,
Hmm.
is when you can't just say the word hydroxyapatite anymore,
Hmm.
because there's micro and there's
Right.
nano. And
Right.
then even further, you can't just say blanketly nanohydroxyapatite, because people have jumped on the bandwagon and manufacturers are making this because they see it blowing up in the oral health care industry, but they're not all following the proper criteria
Mhm.
of how to make these particles. And that's what the SCCS. So this is wonderful as a consumer, because now there should be more transparency from companies. What, where are you sourcing your nanohydroxyapatite from? Who's making it? And what is the particle shape and size? And we spoke about that in earlier episodes, that you do not want a needle shaped particle. You
Mhm.
want a rod shaped particle. And we will link in the show notes the SCCS's final report. And so if you really want to dig into it, it is lengthy, let me warn you. But it took 8 years. And so it was just this past March 2023, they came back with a conclusion that matched their preliminary opinion back from 2015. So after 8 years of science and rigorous, systematic reviews, as you mentioned, they consider it safe for public use with these specifications. So let me find this, because I'm going to read this because I want it to be completely accurate. So, what was the SCCS's final opinion? This was March 2023. Based on the data provided, the SCCS considers hydroxyapatite, that is nano, safe when used at concentrations up to 10% in toothpaste and up to 0.465% in mouthwash. This safety evaluation only applies to hydroxyapatite of the nano form with the following characteristics. They need to be composed of rod-shaped particles with at least 95.8%, that's in particle number, have an aspect ratio less than 3, and the remaining 4.2% with an aspect ratio not exceeding 4.9. The particles cannot be coated or surface modified. So what is the final opinion? Does the SCCS have any further scientific concerns? The opinion is not applicable to hydroxyapatite nano composed of needle-shaped particles. So they're saying they're not approving needle-shaped particles. Um, And then further research needs to happen with breath spray, is what it says. So if you see a nano breath spray out there, I would
Mm.
take caution because we don't understand quite how it's reacting in the lungs. So that being said, they have only, in all of the brands and types that they looked at, which arguably may not be every brand and manufacturer that's out there, they've only approved nanohydroxyapatite that comes from one manufacturer, which is out of Portugal, which is called Fluidity Nova. And they make a nanoxum care paste, which is a extremely high quality nanohydroxyapatite that is used in the brands that you and I have always recommended, Mark.
And not only that, is they have a special version of it. Hydroxyapatite it's calcium, it's an apatite, it's a crystal with a hydroxyl group, water, hydrogen, there's phosphorus in it. And then they have made it even more bioavailable by putting it into a paste. And so, for example, that's what Boca uses. They
Yes.
use that paste, and it gets, once it's introduced into their formula, it's between 2 and 3%. I think it's 2.1, which
Mhm.
is a therapeutic dose,
Yes,
and it's from
93%.
that factory. And that 3 to 1, when it says a ratio of 3, what they mean is 3 to 1. In other words, 3/1 is 3, but it's 3 units this long and 1 unit. So it's a true rod. It's got polished ends. Needles don't sound very good. It's like a sword. A lot of these studies with zebrafish, and zebrafish are used because they are, other than rats, and there's some controversy as to which is better, but it's probably zebrafish for embryological development, for studies on what could harm that. And it's not clear. I've read all the studies, so has the SCCS,
Yes.
and it's not clear what particle sizes they were using, whether it was more than 10%. The studies actually, some studies have 4 different particles, but not the size, not the ratio, and
But
also
shape
not the strength.
and shape, were they
Right.
using needle shape? And they were using this IV. They were
Mhm.
injecting the animals
Right.
in some of the studies with IV nanoparticles. I mean, this is apples and oranges.
Yeah.
You have to be scientifically minded when you look at this. So anyway, I mean, I think
There's a great study out there that discusses the solubility of hydroxyapatite, and it has a very high solubility. In other words, when it comes into contact with cellular fluid, blood, saliva, anything on this side of the cell wall or on the inside of the cell wall, it dissolves into calcium. And there's some water and some hydrogen and all of that. But if it's high in carbonate, that's a CO3, with 2 extra electrons on it. Then the solubility rate goes down. So it's not clear as to which version of hydroxyapatite they were using. And by the way, I checked with the manufacturer, they are very low in carbonate. They have made this version of hydroxyapatite very soluble. That's the whole point. If you want it in a cream or a toothpaste, you want it to be released in solution very quickly, and then you want it to precipitate out. You want it to be very bioavailable when it comes to remineralizing teeth. So again, there's so many variables, and it's a lot of fun to get excited on the web and say, oh my God, this is horrible.
mhm.
Clickbait, right? You get a lot of hits. We like
Clickbait.
bad news before we like the good news, and that's really disconcerting. So we're falling back on the SCCS, on the experts, on all the data, all the research we've done, the clinical background or the clinical data that we've gathered in our practices. You've talked to some IFM physicians that are very
Oh,
excited about
there's
this.
no question
Mhm.
that nanohydroxyapatite is helping patients
Yep.
heal, reverse decay, arrest decay, help with excruciating sensitivity that's affecting their daily life. I mean, you can't deny the clinical outcomes, and the research is there. And then
Yep.
now with the safety, I'm backing it even more. I mean, I love that they took 8 years to look at this. I feel super confident, recommending this to patients if the nano hydroxyapatite is coming from Fluid Innova out of
Right.
Portugal. And so that is why so many of you will message me. I know this happens to you too, Mark, and say, but what about this brand? But
Hmm.
what about that brand? And I have to politely say, I'm sorry, I don't recommend that one. And I leave it at that. Well, now you know why I don't. Because Mark and I, and we decided not to kind of call out each brand on this podcast because that doesn't feel good. But we have emailed basically every big nano hydroxyapatite brand out there, and some were very forthcoming with their information and some were not. And I will tell you, the ones that were, some of them were forthcoming, but they said they sourced their hydroxyapatite in China, or
Or in
from,
the US, and it was actually from China. I mean,
yes.
yeah,
And I can't get behind those brands because honestly, the SCCS hasn't approved them. And this isn't to say the SCCS might look further at other
right. And
manufacturing
they will.
facilities, and they
Yeah,
will. And hopefully, this creates a standard of care where these manufacturing facilities and these brands have to start using high quality nano
right,
hydroxyapatite
right.
that is approved. That's all we want,
Yeah.
right? We want consumer transparency and we want
Hmm.
quality, clean products.
Right.
But I said this on the last podcast. It's really important to remember not all nanohydroxyapatite is created equal. And it's the same as if you walk in to Target or Walmart and you pick up some vitamin C off the off the shelf, versus you go to Full Script
Hmm.
and you source a very high quality supplement. The bioavailability, the quality, I mean, especially like, let's say fish oil, like is it rancid sitting on the Walgreens shelf, or is this a very high quality premier fish oil? It's the same with nanohydroxyapatite.
Right.
And so it's sort of, I really want people to think of their toothpaste like a supplement.
Hmm.
And so we need to think about where are the ingredients being sourced from, and
Right.
how are they being manufactured, and what agencies are approving them. And
And we
so,
talk about biomimetic as being this wonderful thing. I mean, we could scrape it off, a salt lick out in the meadow in a where horses and cows are licking pure salt, but that doesn't necessarily mean it's safe. There are all these different grades, like supplements. Supplements sometimes don't have the full therapeutic effect. They get measured by third party testing, and then also they have bad fillers and binders in there. And so biomimetic is great, but it has to be biomimetic and it has to be a pharmaceutical grade if it's going into your mouth.
and
And
third
that's
party tested.
and
And
third party tested,
I
right?
mean, it's the same with water. All water isn't equal. Some
Yes,
water has bromine and
right.
chlorine and fluoride, and
Yeah.
some is filtered with minerals. I mean, we just need to stop the 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 conversation that
Yeah.
it's
Maybe
banned
we
and that it's all the same.
Right.
So,
Yeah, maybe we
yeah,
need to, when we say biomimetic, we have to say biomimetic, but cleanly and well done,
yeah.
pharmaceutical grade. And that's important. And again, that level of paranoia these days, when it comes to all the toxins that we're being exposed to, like fluoride,
Hmm.
it's important to make sure that if we replace it, when we replace it, I've replaced it in my family, with my family in my life. It's important to replace it with something that we know is better and and is supported by studies and by committees like the SCCS. So I think we're there. We both feel very confident about this.
I'm
And
100% pro
right,
nano
yeah,
hydroxyapatite from
yeah,
Fluid Innova.
yeah. And I
Absolutely.
think other toothpaste brands will switch over. Again,
Hopefully
this
they
is
hear
recent
this
information.
podcast and they get nervous.
Yeah.
We want clean products. We want that
Mhm.
for all of you.
Exactly.
So,
So a lot of these good brands. So if you're interested in a toothpaste and we haven't heard about it, or if you reach out to them and they're not being very clear as to where it's coming from, or they tell you it's a proprietary source or blend, be very wary.
thumbs down.
If they're using the good stuff, they will tell you right away. Portugal, that's all you need to know. Fluidi Nova
Mhm,
and Nanoxum brand, or it's a trademark name. And
mhm.
and so I think a lot of toothpaste brands will jump on the bandwagon. But again, it takes a long time to formulate a toothpaste, to change a formulation,
I
right?
bet it does.
Yeah.
Yeah, it
Yeah.
seems like
So
that might
it's
take
coming,
a long time. Yes.
right? Yeah.
So who should use it, Dr. Berhana?
Oh my goodness.
Everyone. We
Well,
think,
yeah. I mean, 1-year-olds. I'm,
yes.
when you have teeth, people with teeth,
Mhm.
it's. I think we're going to see it in toothpaste for dogs and animals. Of course, it won't have xylitol and other things in it,
Sure.
but
And what's cool is you don't need a lot either. You
yeah,
don't need a lot because you're just supercharging your saliva
right.
with these minerals. And yeah, so anyway, I can tell you, when my patients switch, I see such a tremendous improvement in their
Yep,
oral health
right.
and my own too. I mean, I really do. And so, uh,
Interesting fact on hydroxyapatite, whether it's micro or nano. Um, there's been discussion because I think everyone understands that fluoride is uh, is is going to be gone soon. If you add hydroxyapatite to a municipal water supply, if you add enough, I don't know what the amount is, it literally binds the fluoride ion. It binds with the fluoride ion. Problem is it creates an acid. But
yeah,
isn't that kind of funny that if you
yeah,
add this wonderful material that we've been promoting, if you throw it into the water, it binds and does not make available fluoride anymore. So
it protects us from it. It cleans it up.
right. I mean, it's going to be easy to remove fluoride. That's one of the easiest things we can do to prevent harm to our children and get rid of a forever
When is
toxin.
the,
Just
I
take it
got,
out of the water and
when is
products.
that ruling again? When is Judge Chen? I'm referencing the
Lawsuit
federal
against the
lawsuit, everyone,
right.
about
Yeah,
water
so this is a
fluoridation.
lawsuit against the federal government, against the EPA, and it's been going on for quite a while. For those of you that haven't heard about this, and again, I speak to a lot of dentists. I speak to a lot of dentists in organized dentistry. Very few are aware of this lawsuit. That to me is amazing. It's been going on pretty much. I think it started right before COVID hit, so that's now 2.5 years.
Mhm.
And the last 2 weeks of deliberation, there have been some delays. There was a National Toxicology Board report that was withheld for, I think, 9 months. Everyone wondered about that, although the ADA, the American Dental Association, had access to it. Is that weird or what?
I think they were sitting on it for 6 years.
Yeah.
That's my memory. I
Yeah.
don't know. Don't quote me on that. But
Well,
anyway,
it'll be fleshed out. And so 2 weeks in the end of January, I am going to be glued to my seat. It's been on
wait,
Zoom.
okay. End
Yeah,
of January is when
end
he's
of January.
ruling.
I think it's he's getting frustrated. The judge. I think he's already made his decision. That's probably not fair of me to say, but he has a good grasp of. He has grandchildren. I mean,
Yeah.
I'm hoping he sees this for what it is. But I mean, the amount of fluoride in our water has been halved already. Right
Yeah.
before the year 2000, I think it was 1997. So we've halved it already. If we have it again, then we're going to be below the therapeutic dose, right? So what is the point, especially if it's causing brain damage? But anyway, that's we're not talking about fluoride.
We are talking about, depending on that ruling,
Replacement.
we could
Yeah.
see a lot more
Yes.
hydroxyapatite because,
Yes.
eventually
Right.
dentists, we need a remineralizing
Well,
agent.
Colgate, Crest, all these companies that are
I think
selling
you're gonna see
billions of
it,
tubes and
but
making lots of money.
I worry they're not gonna use the quality
That you know
hydroxy.
what? I think they will probably invest in their own manufacturing, and
Oh,
hopefully they do it
well,
right.
you're right.
Hopefully they do it right. And then, but they're going to put other crap in there. I mean, we know
Yeah,
that they're going to mess it up, but it
yeah,
will. You're right. It's going to change the toothpaste industry.
it will.
And for now, it's just the boutique
It
brands
will.
that have led the way.
So anyway, we are, just to summarize, we are 100% behind quality nanohydroxyapatite. What does that mean? Based on the SCCS's final opinion from March 2023, it's nanohydroxyapatite that's been sourced from Fluidinova. It has to be a certain size, in percentage in the final product, and it needs to be rod shaped, not needle shaped.
Right.
Um, and so, if that isn't enough, if you don't trust these agencies, there's so much distrust here in the United States, then, we're not here to convince you, but we're going to still be promoting it. I'm still going to be using it with patients and my family and my kids, um, because I really do believe in it. And I do believe Fluidinova is making a wonderfully safe product and a very
Yep.
high quality, efficacious product.
Right. By the way, we have no connection to Fluidinova. We're not
No,
investors, or we're
no,
getting a lot of free
oh,
press from
I
us here in
wish
the
I
US.
was.
Yeah. We should,
Man,
but no, they're wonderful. We've spoken to them. They're so
spoken to them.
transparent.
They have wonderful research team
They
too. So
do.
that's partly why, we how long have we talked about this? A year. I mean, since that first article came out, you and I have been paused on Nano, wanted to talk about it a lot, research,
Right.
read, have spoken to a lot of researchers, experts in nanotechnology, manufacturing groups. And so we have spoken to Fluidity Nova a lot and read a lot of the research that they share. I mean, they have
Right.
entire thorough database on all things
And there's a
hydroxyapatite.
lot of biotech in Portugal. There's a lot of tech. I mean, Leica has manufacturing there. They make some of the best cameras in the world. Um, it's an EU company, and they're really knocking it out of the park. And they make more products with hydroxyapatite and other ingredients for the medical market than they do for
Yeah.
dentistry. And I'm glad, because the dental market, the oral health market, is a small market. So I'm very glad
Hmm.
that they have brought this level of sophistication and safety and research to oral health. Oral health always kind of gets forgotten, and then the whole toothpaste industry is just stuff people are throwing into stuff because they think it's not being swallowed and it's not important,
Right.
and there's no science behind toothpaste manufacturing, no evidence-based ideas. And of course, now with the oral microbiome, most toothpastes you can pretty much throw them away because they were not formulated based on the knowledge of what is good for the oral microbiome. So, and that includes hydroxyapatite. Hydroxyapatite is wonderful, micro and nano, for oral microbiome. The
Yes.
cells and the organisms in the oral microbiome need these minerals.
Yeah.
Again, it's what is in saliva
Yeah.
naturally.
Yes.
Yeah.
Yes, and I think it's just important to reiterate that we are sure the SCCS will publicly approve other
Yes.
manufacturing groups at some point. They just haven't yet.
Yeah.
So until they do, we can't mention those by name
Right.
because they haven't been approved yet.
Yeah.
So anyway,
I want to bring up one more point. I just thought of it. We both have discussed this with someone. I think it was a toothpaste manufacturer, and the owner of the company is related to an oral surgeon, and that oral surgeon was finding recently. I don't know how long he's been in practice and what his frame of reference is and context, but and his knowledge base is, especially when it comes to research. But he claims that he's finding a lot of calcified accessory saliva glands, sialoliths. A lot of people are talking, not a lot of people, but some people are mentioning, when you take an MRI of the brain, you see calcified tissue in breast tissue and the pineal gland. You can see it in the kidney. You can see it in the mouth. That's tartar and calculus. That is not from toothpaste.
I know.
And obviously, if there's calcium in toothpaste, there's calcium in food, there's calcium in supplements, there's calcium everywhere. There's calcium in our body. But if your calcium metabolism is off in any way, and that can be related to
Magnesium
right,
deficiency,
blood pressure
K2
meds,
deficiency.
cholesterol lowering meds, which most of us are on, 2/3 of the nation is, hormonal replacement therapy, even calcium carbonate supplements, the way they're formulated, there's calcium everywhere. It's because our calcium metabolism is and our, calcification of the arteries. There's too much calcium in our blood, in our fluid, in our bodily fluids, and it's not getting put in the right place. And you and I have talked about this for a long time. It's because we're not getting enough vitamin K2 in our
K2
diet.
and
That is the shepherd.
trichomoles. Yes,
That
absolutely.
is what takes the calcium, it sees calcium, and it puts it into all of the places where we need calcified tissue, like our
We
teeth.
see
So,
more tartar in
right,
patients and
right.
calculus in patients with
Yeah.
K2
Yeah.
deficiencies.
So beware
There's
of all
that
these anecdotal stories from surgeons
correlation
and
is not
calcium
causation.
calcifications. I'm seeing more of
Yes.
it. Yeah.
It's a
Okay.
bigger issue, and there's
Yeah.
that wonderful book, The Calcium Paradox.
Yes. By Kate Room
Yes.
Blue.
So if
Excellent.
you're interested in this, I had one person reach out and said she muscle tested for pineal gland
Oh,
calcifications due to
right.
the toothpaste her patient was using. And I mean, you guys, we have to be scientific about this. And
Please.
so of course I'm thinking, no, 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 you're missing something much more important in that patient's medical history.
Right.
than their
Yeah.
toothpaste.
And muscle testing needs to be done with a machine
Yeah.
that applies the same force each time, the exact same force, and can measure the equal resistance to that.
Yeah.
And
That's a whole other.
even then, I mean, muscle testing while you're waving a product over someone, I mean, it's yeah. We need more evidence-based approaches when it comes to making these big decisions.
Yeah, before we start demonizing something,
Yes.
right? So
Yes. Oh, we like to
anyway,
do that on the web. It's very popular, you know.
especially in the United States, we have
Yes.
learned, haven't
Yes.
we?
Yes. Well, it helps build websites,
We love a good rumor and conspiracy theory
of
here.
course.
Anyway,
Good.
well,
So
I hope that helps
next,
anyone.
chapter 4, part 4 of this
Mm.
series will be an announcement that we're going to be making. And I think we're not sure when, but that's coming soon. We want to talk more about hydroxyapatite as it relates to oral health, but we're going to connect this now to, I know you think it's very exciting as well, but a very exciting announcement,
Yeah.
something that we've been working on, and we will uh, make that available and apparent to everyone in the next few weeks, we think.
And
So,
we're going to talk just more about toothpaste in general. And because it's not only the hydroxyapatite show,
yep.
there's a lot of other ingredients.
Hmm.
And there's kind of like do's and don'ts. And so
Hmm.
we're not going to spend a lot of time on this, but I do think it's important. You know, you and I both do posts occasionally on this on Instagram, and I know you have blog posts too, but I think it's nice just to put it in a podcast form too. Like, we need to start reading ingredients to our oral health
Hmm.
care products. And so these are ingredients sort of on the no list, and these are things that we think should be in toothpaste.
Right.
So
And
stay tuned.
we're gonna give more specific. We're gonna make it easy. If you've followed us this long through these 3 chapters on hydroxyapatite, thank you. But trust me, we're gonna make it easy for you. We're gonna make some recommendations next time as to what we specifically recommend in terms of certain products.
Amazing.
Yep.
Thank you so much, Dr. Brahana. Thanks
Thank
for
you, Dr.
hanging
Staci.
with me this past
That felt good to
year.
get it off my chest.
Me too.
Yeah,
You all, this has been on our to-do list for 12 plus months. And we've hemmed and hawed and paused and waited for more research and
right.
waited for another conversation to happen. But
Right.
we are,
And this is not the end of this. I mean, there's going to be more discussion. There's going to be more data. As soon as more data comes out, whether it's good or bad, you're going to hear about it from us. And that's what we do. And if we put it in our patients' mouths or recommend it, and if we put it in our mouths, we want to know as much as possible about it. We also want replacements and alternatives to fluoride. We've got to get rid of fluoride. Fluoride is a very dangerous substance that we've been using too long. We've got to save the kids, keep our kids healthy.
we got to keep the kids healthy. And in a modern world, we need remineralizers in our toothpaste because
Absolutely.
modern food, we can't compete with the modern diet. So
Yep.
we need those remineralizers. So anyway, well, thank you
Maybe
so much.
we should make an element-like product for the mouth.
Oh, a little,
Just electrolytes for saliva.
oh, okay. Well, let me
Anyway,
start
we can do it
outlining
in toothpaste. We can do it in toothpaste. Right.